Hi, and welcome back to Abnormal Psychology. Now, this chapter is on dissociative and somatic symptoms and related disorders. Now, we're going to do this as a part one, and that's going to be the dissociative. So, the dissociative and somatic symptoms and related disorders were historically linked with anxiety disorders, and as a form of what they would label at that time was neurosis. Now, anxiety is expressed directly in different forms in the anxiety disorder, which we covered in chapter 3. But it plays a role in dissociative and somatic symptoms and related disorders is inferred. So we're going to start with dissociative descriptions, theoretical perspectives, and treatments in part 1. In part 2, in this same week, we'll do somatic symptoms, the descriptions, the theoretical perspectives, and the treatments in part 2. So let's look at a couple of scenarios here. Sally is 28 years old and is a student who was found unconscious by her roommate. Now, Sally was not able to remember her identity or any information about her life. Examination showed no neurological abnormalities or evidence of substance use. Now, she remained amnesiac for 10 months until the clicking sound of a tea, began stored triggered memories of her mother, and later more memories of other aspects of her life started to return. Little Just, and we put that in quotes, is a young child who laughs and giggles. Gravely Voice is a man who speaks with a raspy voice. The one who walks in darkness is blind and trips over furniture. Bid Judy, she's articulate, competent, and funny. And these are only 4 of the 44 personalities that existed within Just Castelli. That's her name. She was initially diagnosed with schizophrenia, but later was told that dissociative identity disorder was a more appropriate diagnosis. Now, she's a singer, a musician, an inventor, an artist who has also become a lay expert on mental health issues. Normally speaking, there is a unity of consciousness that gives rise to a sense of self. We perceive ourselves as progressing through space and time. In a dissociative disorder, one or more of these aspects of daily living is disturbed. Sally and Judy are examples of 2 dissociative disorders. Let's find out more about these disorders. Dissociative disorders involve changes or disturbances in identity, memory, or consciousness that affects the ability to maintain an integrated sense of self. So instead of the way that we get around normally, we don't give a second thought about who we are and where we are and what we're doing, someone in a more of a dissociative identity disorder or dissociative disorder don't always have that luxury. So for our purposes, dissociative disorders include dissociative identity disorder, not unlike the examples in the intro, dissociative amnesia, and depersonalization/derealization disorder. And we'll look into each of these as we go. We're going to start with dissociative identity disorder. In dissociative identity disorder, sometimes referred to as split personality, 2 or more distinct personalities, each possessing well-defined traits and memories, exist within a person and repeatedly takes control of the person's behavior. Now, this was also known as multiple personality disorder years ago, but it's been updated since. And each of these personalities usually show an integrated functioning on cognitive, emotional, and behavioral levels. Often, there is a dominant personality and subordinates, and they involve severe alterations or detachments in identity, memory, and consciousness. There can be the adoption of several new identities, and these identities display unique sets of behaviors, even voices, and of course personalities. It involves what are known as alters, which refer to the different identities or personalities in a person with dissociative identity disorder. The host is the identity that seeks treatment and tries to keep identity fragments together. A switch it's when one personality, a switch is sort of the instantaneous transition from one personality to another. It's not something that happens over the course of several days or more. It's relatively quickly. Now there's two examples in movie form. Three Faces of Eve and Sybil are celebrated examples of dissociative identity disorder. However, there have been more research and questions about, how frequently would something like this occur and the fallibility of some of the diagnoses that have been made historically. Dissociative identity disorders are rare, and they seem to have a particularly North American tendency. So that started thinking a number of different research, but one of them, Nick Spanos of the Carleton University here in Canada, did think that multiple personality was a distinct disorder. He didn't think that. He didn't see it as being a disorder in and of itself. He instead saw it as a form of role-playing. First, individuals would see themselves as having multiple selves and would act in ways consistent with how they thought the disorder was. Then, intentionally or unintentionally, a therapist or counselor would reinforce the thought that multiple personalities were in fact at play for that person. And so it's brought some questions as to how accurate might be some of the diagnoses, and perhaps some additional research really needs to go to determine what it is, what it's not, and therefore what might be treatment possibilities. Now, dissociative amnesia. Dissociative amnesia involves the loss of memory for personal information. The person experiences memory loss in the absence of any identifiable organic cause. General knowledge and skills are usually retained, but there are 5 types of dissociative amnesia, and I'll just touch on them. One is known as localized amnesia, and then systematized. In what's known as dissociative fugue, well, the person actually travels suddenly away from home or place of work, shows a loss of memory of his personal past or their personal past, and experiences identity confusion and may even take on a new identity. Now, sometimes people say that they do not remember events or things like that. Pretending amnesia is what's known as malingering. Faking illness so as to avoid or escape work or other duties, or to obtain benefits. Now, the last little group we'll mention here is it was that sort of slash group of depersonalization, derealization disorder. And it involves persistent or reoccurring episodes of depersonalization, derealization, or both, that are of sufficient severity to cause significant distress and impairment in functioning. So let's determine what those two terms mean. Depersonalization involves feelings of unreality or detachment from yourself and or your body. It's as if one were a robot or functioning on automatic pilot or observing oneself from the outside. It's not an experience most of us have. In derealization, there's a loss of a sense of reality for one's surroundings. You know, you experience it in terms of strange changes in the environment. You don't understand what are those things walking past you at that speed. They might just be people walking next to you on a sidewalk, but you won't have a good idea of what they are. So in that instance, you know, your changes in your environment could be people or objects changing size and changing shapes, or in a sense, it's the passage of time being done quickly and you're not noticing the passage of time. It's quite an unusual experience. Episodes of derealization are characterized by a sense of one's surroundings have become strange, you know, unreal. For example, colors may be washed out or very bright, and time may seem to be oddly slowed down or even sped up. So how might these experiences be explained? Well, let's check out some of the theoretical perspectives as to what they think. And as usual, we're going to start with the psychodynamic theorists, where they view the dissociative experience as a form of psychological defense, by which the ego defends itself against troubling memories or unacceptable impulses by blotting them out of the consciousness. There is increasing documentation of a link between dissociative disorders and early childhood trauma, which lends support to the view that dissociation may have or may serve, I guess, as a, to protect the self from very troubling memories. Learning and cognitive theorists, they view dissociative experiences to involve ways of learning to think about certain troubling behaviors or thoughts that might lead to feelings of guilt and shame. Relief from anxieties, negativity, reinforces this pattern of dissociation. The social learning theorists and cognitive theorists suggest that multiple personalities may represent a form of role-playing behavior. Now, some dissociative states, like dissociative amnesia and fugue, may be transient and terminate abruptly. The interactionalist perspective, the diathis stress model, suggests that since only those more predisposed to fantasizing, openness to altered states, and receptiveness to hypnotism may predispose individuals to develop dissociative disorder in the face of extreme stress. That could be events or people. Remember, with the diathis stress model, personality traits here are not themselves the issue. However, they may increase the risk of those under extreme stress trying to cope. Now, most people, they can manage and or decide to push uncomfortable thoughts away or just choose a different approach. Remember, the diathis stress model is about predisposition. It's often a genetic underlying, when the levels of stress get high enough, it might activate and express the predisposed issue around a disorder or a weakness or a vulnerability. Those with predispositions are more prone to disorders than those without predispositions. So what about treatment then? I mean, it still doesn't seem like it's been really clear. So if we look at what treatments will be helpful for dissociative disorders, the psychodynamic approach does help people uncover and cope with dissociative painful experiences from childhood. Little is known about what will work, as there are very few examples to work with. Research suggests that cognitive behavior therapy and some types of medication may be helpful in treating depersonalization disorder. And if, the biological approaches do focus on the use of drugs to treat anxiety and depression, they're often associated with the disorder. But drugs have not been able to bring about integration of all personalities. Psychologists will work with the most dominant personality and try inviting others out, and the goal is to work together towards reintegration. All right, that's the end of part 1. It's just looking at dissociative disorders. And in part 2, we'll do the same. We'll look at somatic symptoms and related disorders, and we'll look at the theoretical perspectives. We'll look at the description, theoretical perspectives, and also the treatments. All right, so we'll see you in part 2. Bye now.